Hi Dr. Sandeep. Could you please explain about breast cancer recurrence? The treatment when it recurs?
Breast cancer can come back just like any other cancer. But whenever the cancer is treatable, we can still treat it and get a result. Now, what are the scenarios which are possible in this? There are 4 distinct scenarios which I can think of. One, the local recurrence, the recurrence within the breast itself, wherever the first cancer occurred. In these scenarios where the recurrence has occurred in the same breast, we tend to treat these cancers by surgery, and most of the times, if a breast conservation surgery was done, that is the breast was saved previously, we will remove the breast. If it is not saved, if it's there in the skin of the breast which has been left behind, then we go for another surgery to remove it and we reconstruct that area. So whenever it's possible, surgery is the choice in these cases. We might recommend further radiotherapy or chemotherapy based on the scenario. So that decision will depend on various other factors. Second distinct scenario is a regional recurrence. Regional, when we talk about, say, the lymph nodes in the armpit. There could still be some lymph nodes even after a complete surgery has been done for lymph nodes, which may show some disease, which may throw up disease or grow disease after a few years. Again, in these scenarios also, the treatment remains to be surgical. We remove the tumor. We might give a radiotherapy on top of it, and very often chemotherapy would be required to consolidate the effect and give a cure. Remember, even in regional recurrences, when it is in the lymph nodes, our attempt still remains to give a cure. Like the local recurrence, even regional recurrence, the attempt is still to cure the disease and get a good result. Third distinct scenario is a distant recurrence. When we say distant recurrence, the recurrence is happening in some areas other than the breast itself and the armpit. So it could be recurrence in the lung, it could be recurrence in the liver, it could be recurrence in the bones or any other place other than these. In these kind of scenarios, the results are not good. These are stage 4 diseases. So these are happened because the disease had migrated, the few cells of these cancer had migrated before we treated them, and the treatment did not eliminate the entire disease. So this kind of recurrence very rarely is treated surgically. They are usually treated by the form of radiotherapy or with chemotherapy or a combination of these. So these scenarios are 3 distinct scenarios in which it can happen. But apart from this, the 4th scenario which we can think of is a fresh disease coming in the opposite breast. Now, whenever there is a new disease in the opposite breast, it could be a spread from the breast which happened to have cancer first, or this could be a new cancer which has occurred in this opposite breast. So these tumors are staged again with the form of PET-CT and other forms of tests which we need to do, and they are treated as per the merit of case. So it will differ from case to case, which has to be discussed in detail before we go ahead. So overall scenario, most of these cases come in still a treatable condition if the patient is aware and comes to us in time before it becomes a much complicated form of cancer.